Ladies and gentlemen, welcome to the Beautifully Broken podcast. I am sitting here with Dr. Katie Deming. Katie, welcome to the show for a second time.
Thank you, Freddie. It's my pleasure to be here.
Katie, if we were passing each other on the street and we bumped in, we're meeting for the first time, what would you tell me you do?
I am an integrative oncologist.
Beautiful. And how did you find your way into that work?
Yeah, well, I started as a radiation oncologist. I went to Duke University and studied medicine and went into radiation oncology. I knew actually coming into medical school that I wanted to be an oncologist. I didn't know what kind, but I had had an experience volunteering at hospice as an undergrad that really changed my life. And I loved the intimacy and the connection of being with people who were dealing with cancer. And that's what led me into oncology and then radiation oncology. And I practiced radiation oncology for 20 years and also served as a healthcare leader, ran end-to-end cancer services for a large healthcare organization. But in 2020, I had an experience that really changed everything for me, where I saw what we were doing in Western medicine was not correct. And that for me, it felt misaligned. And so in 2022, I left my specialty of radiation oncology and have now launched an integrative practice to help people in a more holistic way.
Beautiful. What are we doing wrong?
Wow. I think the question is like, well, this has been a really interesting experience for me because I'm so highly trained, right? So to become a radiation oncologist, I went to undergrad for 4 years, then medical school for 4 years, and then radiation oncology for 5 years. Didn't get my first job until I was 32. And what I'm learning now is that I was taught within a system that it does exactly what it's designed to do, but it's designed really to treat disease. It's really designed to treat disease, and specifically with pharmaceuticals, or in my case, very expensive linear accelerators. And, I think the whole concept of Western medicine is backwards. And I think that it's taken me, it's like one of those things where I couldn't see it when I was inside it. I just knew something was wrong. So starting in about 2019, I was like, something feels off, but it didn't make sense to me. And then in 2020, when I had this experience that similar to a near-death experience, I just saw it. I was like, okay, this is not the way that the body heals. But the truth is that I didn't know how it healed. I didn't know what the answer was. I just knew that inside something was telling me this is not the way. This is not the way the body heals. And now that I've taken several years, it's been since 2020 now, 3 years, and really studied how does the body heal? Like, how do you create health in the body? Because everything I was taught as a medical student and as a resident and then as an attending practicing radiation oncology was all about pathology. Like, when something goes wrong, this is what you do. But the truth is that I wanted to know, well, what is the optimal state of the body? Like, what does it look like when the body is functioning optimally? And that's really what I've spent the time looking at. And I realized that, frankly, everything we do in Western medicine is backwards, and it's designed in that way. So it works exactly as it's designed. It's designed to fix problems, but it doesn't actually get to the underlying cause. And that's one of the things that I've really seen as I've stepped outside. It's like they say you can't see the label from inside the bottle. Like, I couldn't see the label. And the label on the outside is like, this is a system that is designed to treat problems, symptoms with medications, right? And so now that I'm outside, I can see that and be like, okay, there's a role for that. I'm not totally anti-Western medicine. I think there's a role for it, but I don't think that it is the primary way that we should be approaching healing. And that my approach now is really looking at, how do we restore health in the body? And also, how are we not fighting? Because, this idea of fighting cancer is actually quite backwards, and gets people into this state of fight or flight and sympathetic activation. But the truth is that when we're fighting something that's within ourselves, we're fighting ourselves, right? And so my approach is much more of a healing perspective of how do we start to work with our bodies? How do we understand how the body functions optimally and understand how Freddie's body works best, right? And everybody's body is different. And that's another part of Western medicine. It's all algorithm based. I pull up someone, I look at, okay, their receptors are this, they're, this and this and this, and then it spits out exactly what I'm supposed to do. But the truth is, two people with that same disease, same markers and everything, may need a totally different approach, So it's really looking at the individual and looking at how do we get back to ourselves, and it's not just physical, it's emotional, mental, spiritual, the whole package of bringing people back to themselves so that they can create health in their body. Because that's what we're born to do. We're born to be healthy.
Yeah. Amen. We are born to be healthy.